forever. And so, and then I guess I'll just be a grad student. I don't know. It's bad when I'm a better clinician than I was 4 years ago when I started, medical transition, but yet I hardly have any patients. And so, because, I adopted the lifestyle.
But you're a better clinician now.
Yeah.
It's funny because you took that pain and the traumas, like, and it can help if we take it in a different approach instead of, staying in it. If we take a different approach and kind of have this growth in it, it's like, that's telling, Tori, to be able to say, I'm actually a better clinician now.
And I can't say that from
and that speaks to your authenticity.
Right. Absolutely. But my patients tell me that. They said, I like this version of you better. This version of you doesn't hide behind the facade that you did before. This person is more outgoing. This person is in touch with emotions. This person, listens better. This person is somebody that I want to be with forever as a provider. And so, when my patients are giving me feed, the ones that stayed, and I do have loyal patients, it's just not enough to cash flow it. And so, and I do have very loyal patients that, the half that stayed behind. Listen, my herd of 100 sheep, it wasn't one that got away. 50 of them went and wandered off. And the other 50 weren't enough to pay the bills, but my 50 that stayed behind, amazing, truly amazing. And so, but I know I'm better than I was when I first was, because I've had, 4+ years of experience. July's been 4 years on gender affirming hormone therapy. Like I said, the second puberty is a lot better than the first one. And so, a lot of things have happened during that time, right? Transgender people have been allowed to be in the military and then taken out of the military and then allowed back into the military, I've seen a lot of things during that time. Now gender affirming care is in any of those Obamacare Affordable Care Act plans. It does pay for your gender affirming care, and so that is a nice thing to see. So there's been a lot of changes just in the 4+ years that I've been down this road, and it's been a good thing. But like I said, trucking along, lost about everything, living my country song life, and hoped in the future to be more in. I love research. I just was on a call this morning. KU Med is doing a transgender elder study, which is exciting because there's not a lot. 65 and older population with transgender. They're kind of focusing on transgender males, females, but I'm trying to get them to look at non-binary and transgender males as well. But I was added to that study as a co-investigator, so I'm excited to get on a research study.
I'm glad they're doing that, because our area, this area, Natone's Mercy has the clinic, but I wish there are some facilities here that could do more research in regard to sex, gender identity, sexual orientation in the education, because it seems like I hear, and I'm so glad you as a clinician to talk to, because I do hear things with, in the LGBT community that will say, oh, I'm a diversity inclusion consultant, but a lot of their curriculums that I've seen seem to be based a lot on these kind of trauma response things that seem to be, this is what you have to do. But I'm glad that there are clinicians out there that see that there is a need, and from both sides of there, and there needs to be some better education through research.
Absolutely.
Of how we can incorporate better spaces in the education side. So I more research, and it's not to say that it's like, is it because we have to prove ourselves? Like, no, that's not it. That's just saying, like, we're obviously seeing there is and I remember a director of nursing. She was a director of labor and delivery, and when I was talking to her and meeting with her, and she said, I wish our staff, our nurses, were representative of the majority of the community that we serve, which was Black females. And so then we start seeing, like, there needs to be better research and better representation of that for a Black female to relate to that health in the whole body health. Because right now everybody's thinking whole body health. And so that is going to allow that research to see what practices can we put in place, and the research to suggest how we can improve our healthcare for LGBT, for transgen. And I think that's I'm so glad they're doing that at KU.
And one of the exciting things is that in the School of Social Welfare at University of Kansas, just in the last 12 months, they've started an LGBTQ research center. And so they're actually ongoing, and they have 4 big researchers that are involved in that process. Good friends of mine that I've had a chance to partner with and see speak, great PhDs, great social workers. And so they actually had the first IRB approved study for 13 to 18-year-old LGBTQ youth in the state of Kansas. And so that's the first study that we've got. And again, we lack that baseline data. So when you go out there and you're looking at health equity of a marginalized community, and that the LGBTQ, all the letters, right? Every one of them. We don't have the baseline data to say, well, we need resources, we need money for programming, because we don't even know what our baseline is.
Right. We don't know what we're building program from.
Right. And so, but
we're just building it right now from we're not safe, we're rejected. That's kind of what it's like, okay, absolutely. Yes. Yeah. Okay.
So now we're going to be able to look at, access to care. Now we're going to be able to look at, what is your experience with harassment? What is your experience with intimate partner violence? What is your experience with homelessness and housing? And what's your experience with insurance affordability and all these things from, not just youth, but adults? And being able to have those baseline numbers is going to be huge and across the spectrum, right? Like the cohort that we're specializing on is going to be the 65 and older, because again, Medicare population, are you able to get healthcare? Are you able to? Because we still know that there's a considerable bias within healthcare, and that some doctors still turn away trans people, still turn away people that are gay or bi, and it still exists. Hell, Arkansas passed a law that said they didn't have to treat you.
It was like, what is it?